Chairman, my name is Ina Apolikhina. I am head of Obstetrics, Gynaecology and Rehabilitation Department, Moscow, Russia. First of all, I would like to thank the organizers committee to invite me and it's possible to share our data and experience. It's our conflict of interest disclosure. We use equipment CZF. It's very interesting equipment for lower genital tract. Our research center incorporates Institute of Obstetrics, Gynecology, Perinatology, Oncogynecology, Mammology, and Reproductive Medicine. There are also 9 institutes and more than 20 laboratories carrying out research work. I would like to take a few minutes of your attention to describe our department and its activity. The Department of Obstetrics, Gynecology and Rehabilitation was first opened in Russia in 2019. Today is multifunctional department that uses all the innovative technologies of diagnostics and treatment of gynecological diseases. For 8 years, we have been training doctors, conducting scientific research, and providing medical care for women with various gynecological diseases and aesthetic problems. According to the data of our department, over 2014-2020 years, the incidence of lichen sclerosis among other vulvar disorders is 63% and it grows every year. Now we actively cooperating with China, especially National Ultrasound Medicine Engineering Research Center. And now, let me share our experience in using HIFU technology in treatment of non-invasive or non-neoplastic epithelial disorders of vulva. We use a special nozzle to treat the vulva. Before HIFU treatment, we usually perform effective local anesthesia with, as usual, 1% of lidocaine. That is how we perform the HIFU procedure on vulva. And after effective anesthesia is pretty comfortable for our patients. Our observational study included now 173 women with 78 women with lichen sclerosis and hyperkeratosis. As usual, we perform 2 HIFU sessions, and the follow-up period is on 3, 6, and 12 months after. We diagnosed vulvar disorders by means of visual examination, vulvoscopy, optical coherence tomography, ultrasound, microbiome, HPV with PCR reaction, and fluorescence diagnostics and punch biopsy. The diagnosis were verified by punch biopsy and histological examination. Indications were tumor eradications and its exclusion, insufficient therapy of standard therapy, and differential diagnosis with vulvar intraepithelial neoplasia, lichen planus, and other dermatosis of the vulva. For effective visualization of neoplasm, threads, and fillers, we use high-frequency ultrasounds of the vulva, 12 to 23 Hz. This allows us to examine superficial structures. This slide shows a possibility of ultrasound diagnostics in the assessment of blood supply elastography, even measurement of thickness of dermis and epithelium. We actively use also a mobile colposcope, EVA, which allows effective early diagnostics of vulvar disorders and online consultation. I want to emphasize that it's very important to diagnose vulvar intraepithelial neoplasia and vulvar cancer as early as possible. Quite often we diagnose these diseases in patients who address for aesthetic problems. For example, the bottom three photo shows serious vulvar conditions such as VIN3, now we call HCL, extramammary pages cancer, and melanoma of vulva, while women come only with a complaint of itching of vulva. Extramammary pages cancer is a rare type of genital cancer, of course. Usually it's treated by vulvectomy. Fluorescence diagnostics allows to determine the exact stages of the tumor, thereby reducing the resected tissue demand during surgery. Since 2022, in cooperation with Russian physicists from other regions, such as Nizhny Novgorod, we have started development of a new method of multimodal optical coherence tomography to diagnose lichen sclerosus. Optical coherence tomography is an emerging tool for non-invasive visualization of the tissues with high resolution up to several micrometers and penetrations depth up to 2 millimeters. This method correlated well with histological examination, and we can assess the dynamics in the restoration of the structure of connective tissue, epithelium, tropism, and blood vessels at different epithelium layers. In this picture you can see this equipment, and often we use these diagnostic tools in diagnosis of lichen sclerosus. So I would like to show you several clinical cases. Patients 68 with lichen sclerosus and genitourinary syndrome of menopause, treated by 2 sessions HIFU and estriol cream 0.5 milligrams per vagina twice a week. The follow-up period was 14 months. Then symptoms of cracking returned, and patients started PRP and topic glucocorticosteroids because of COVID-19 pandemic limitations. These patients improved symptoms, and she satisfied from treatment, but she had cracks in posterior commissura, as you can see on the last picture. Here is another second case in the patients 42 with lichen sclerosus and stress urinary incontinence. She was treated with 1 HIFU session. Follow-up period was 6 months. Then itching and burning returned, and the patient started PRP plus glucocorticosteroids. This clinical case demonstrated efficacy of HIFU is limited to 3 months. Besides, HIFU technology has no therapeutic effect on stress urinary incontinence. Third case in the patient 73 years old with lichen sclerosus and genitourinary syndrome of menopause. She was treated with 2 HIFU sessions. Follow-up period was 6 months. Then symptoms such as itching and burning returned, and patients started PRP plus glucocorticosteroids. The next clinical case in patient 36 with lichen sclerosus. She was treated with 1 HIFU sessions. We observed reducing the main symptoms of lichen sclerosus, itching. Follow-up period is 12 months. The patient is under observation. The fifth case in the patients 42 with lichen sclerosus. She was treated by 2 HIFU sessions and estriol cream 0.5 milligrams per vagina twice a week. Follow-up period was 1.5 years. Then symptoms of burning and cracking returned, and patient started standard our procedure, PRP plus glucocorticosteroid with optimal effect. In this picture you can see interesting patients, 44 years old with vulvar hyperplasia. She was treated with 2 HIFU sessions and 3 sessions of autological platelet-rich plasma procedures. All symptoms disappeared, but visual changes were insufficient. Follow-up period was 2 years. Patient started topic glucocorticosteroids once a week, and we consider HIFU in combinations with glucocorticosteroids to be more effective in case of severe hyperkeratosis. This is a very interesting clinical case too. Patient 40 years old with lichen sclerosus and vulvar synechiae. We performed treatment with estriol cream, local estriol cream, 0.5 milligrams once a day, 2 times a week, mometazone cream in case of severe itching, and HIFU 1 procedure. We provided synechia resection in future with surgical CO2 laser. Sorry, that's video. This slide shows successful cure of patients 39 years old with vulvar intraepithelial neoplasia, mild degree, now we call high, HC, after 2 sessions of HIFU and at 3 months interval. She had no visual sign of VIN, but after 2 sessions of HIFU we observed disappearance of itching, and according to histological examination we started complete cure. In this picture you can see a clinical case in patient 48 years old with lichen sclerosus. We performed 2 HIFU procedure with 3 months interval. Symptoms of burning completely disappeared. Follow-up period was 1.5 years. Then cracking returned and patients took 2 PRP injections with optimal effect. A very important question remains. What is the optimal interval between HIFU section? The patients on case 10 treated with 2 HIFU procedure of monotherapy with the interval 6 months, and we concluded that it was very long time with sessions and the diseases relapsed. By now we provided 3rd session and added hyaluronic acid and topic glucocorticosteroid with optimal effect. Patients 58 years old with lichen sclerosus. This patient is very interesting because 2 years ago she had cancer of vagina. These patients performed radiations and surgical therapy for the cancer of vagina in situ 2 years ago. We performed 1 session HIFU, which intermittent therapy with glucocorticosteroid, mometazone, cream of vulva twice a day for 2 weeks, 1 month rest and repeat. Our data shows that HIFU technology is more effective in young and pre-menopausal women. 72% of patients noted the absence of itching and burning 1 to 3 days after procedure. The optimal course is 2 sessions and interval between procedures is 3 months. High efficacy when combined with PRP or glucocorticosteroid or hyaluronic acid, and adverse events were reported in our investigation in 2 patients. It was burning. In our investigation, only 2 patients showed local skin burns. We presume that this complication could be caused by a defect in the lens. Patients were successfully treated with regenerative local ointment and physiotherapy. Often we use low energy laser and other method of physiotherapy. In conclusion, I would like to say that HIFU therapy advantages are low, it's minimally invasive precision procedure of our outpatients, repeated with no limitations, high efficacy with low adverse event, and of course needs further multi-center randomized clinical trials. Since 2019, our institute has actively collaborated with China researchers. And of course, I hope that our cooperation with HIFU technology will be continued and results of our work can be published in our joint reports. Our weapon is knowledge, but remember, it may be knowledge that we may not know we have. Thank you for your attention. Спасибо.